Hi, my name's Jonathan. I'm a qualified physiotherapist. I have a private practice in Johannesburg, focusing mainly on sports injuries, which is my interest and my passion. I've always aligned my professional career with interest. I've been a competitive sports person for many years. I also did a BSc honours in sports science, and my physiotherapy and my sports science have always gone hand in hand, and have always kept pace with my interest, which is generally staying well and helping others to stay well. And I think that's one of the main reasons why I thoroughly enjoy my career. As a sports person, I understand the frustration of not being able to participate, and to be able to help people to get back to their activities and to be able to compete is one of the greatest joys of what I do. And I have been through an issue myself, and it's an issue that I would like to share because I think that possibly my experiences will help others in maybe overcoming similar adversity. A couple of years ago, I noticed that I was starting to struggle a little with what I interpreted at the time as kind of a hip pain, but hadn't gone any further than that in terms of diagnosing what the problem was. And just over a year ago, after extreme pain, both in my leg and in my groin, which I'm going to get back to because there's a parallel story with my hip and my groin, I was told that I required a total hip replacement. It was a shock, came totally out of the blue. I was totally unprepared for it. And having clinical experience, nonetheless went in with somewhat open eyes and thinking I knew what was going to happen. And I did for the majority of the experience. There were a couple of hiccups along the way, but on the whole, a year down the line, and I'm back in the game. I'm back working. I'm probably not going to return to competitive sports. I think my competition days are over, but I'm back teaching my spinning classes at the gym. I've become an avid swimmer. I do my weight training, and I just love exercise. And I'm so happy to be back. And I think the story behind my return to where I am today is a very valuable one. When I was told that I required a total hip replacement, I then looked around in terms of my best options for who I would consider for surgery. I ended up consulting Dr. Johan Buerta, an orthopedic surgeon at the Morningside Clinic. And we then embarked on this journey together. And a couple of gory pictures to tell you what the consequence of all of that was. But as Dr. Buerta explained to me, he said, the ideal situation in your right hip would be a ball that looked something like a billiard ball. He, to put it bluntly, said the ball of your hip joint looked more like a cauliflower floret. And that is the ball of my hip joint. Once it had been severed at that position, they then put the ball and remove it. And they place a titanium prosthesis into the shaft of the femur. The titanium ultimately is capped at the end with a porcelain ball. And in my situation, I was hoping initially that I would get away with having only the ball replaced, only to be told by Dr. Buerta that unfortunately the socket in the pelvis, or acetabulum it is known, basically matched this gory picture of the ball, and that I would have to have the socket replaced as well. So we have a titanium shaft, porcelain ball, and a polycarbonate cup that they embed into the pelvic joint. The titanium shaft of the prosthesis and the polycarbonate cup is in fact embedded with bone chips. And the reason why they do that is they try to create a bioactive surface that will maximize the bonding of your bone with the prosthesis. And when I went back to see Dr. Buerta a year later, I had to have x-rays first, and by the time we sat in his office and discussed, my x-rays were very proudly displayed up on his screen. And he sat back and he said, not because I did the surgery, but because any orthopedic surgeon will tell you this was what we would classify as a perfect result. So the bonding that had occurred between the prosthesis, both in the femur as well as in the pelvis, had optimized and had created a perfect bond, and hence my perfect result. I don't think it was coincidental that a couple of months before that I started taking Equilibrium collagen. I came upon it by default. I eat predominantly a plant-based diet. I have decided of late to increase my protein uptake. And after getting my head around the fact that I was now going to start taking collagen, I shopped around and I eventually discovered Equilibrium. It was recommended to me by a colleague at the gym, and I've been on it ever since. And I am of the firm opinion, both experientially and clinically, that it has contributed significantly to my recovery and when I'm where I am right now. What was interesting for me is, and as most people that end up having a total hip replacement will tell you, is that one of your most alarming or one of your most severe symptoms is in fact groin pain. And that's most of the reasons why people end up going to see an orthopedic surgeon, not because they have hip pain, which would be pain somewhere actually down the leg, but this gnawing pain that you have into the leg makes sleeping difficult, makes movement difficult. And that is because of the nerve supply of the hip. And that is the reason why it manifests as groin pain. And the groin pain post-op, the pain in my leg, the pain that caused me to go and see Dr. Buerta, that deep nag in my leg at night that affected sleep and getting up in the mornings, made it difficult for those first steps in terms of movement. That all got better, but the groin pain improved, but it continued as a nag. And over the last couple of months, there has been a significant improvement in that. And that was when I put two and two together and went back, because prior to the story with my hip, I had a bilateral hernia repair. That was congenital. I was predisposed to that condition. And they did what is referred to as the Gilman procedure, where they put a piece of mesh into the area of the groin. Looks very much like that gecko that you have in the boot of your car to stop the stuff sliding around, except it's 18,000 Rand for a piece this big. So it's a lot more expensive than gecko. And contrary to popular belief, the reason why they put the mesh into the area of the groin is not to close the defect. It's to create, once again, a biological interface so that your tissues can ultimately infiltrate the area. So this gory picture that you're seeing here is the lower abdominal muscle area, and this is the area in which they perform the Gilman procedure. So they slice and dice and they place the mesh in, and that then facilitates the growth of your connective tissue and muscle into the area to strengthen the area. It's not the mesh that fixes it, it's the repair of your body and the growth of that connective tissue. And that was when I realized that the dramatic shift in my groin pain was probably more related to the fact, once again, of being on Equilibrium collagen and allowing the plasticity and the invasion of that area both by my muscle tissue and my connective tissue. So it ended up being a double win for me. Both the right hip, the bilateral Gilman repair that I had in the inguinal area, and here I am, a year down the line, and I'm as good as new. Probably not the competitive athlete that I was. A little bit of wisdom has probably led me to believe that I don't want to be the competitive athlete that I used to be. But I'm back doing the things that I love. I'm back swimming. I'm back doing my gym. I teach my spinning class every week, and that in itself is quite something in terms of the achievement. If one analyzes the biomechanics of what is happening on the bike, and when I look back at where I am today compared to where I was in November of 2023, it has been nothing less than a miraculous recovery. I like to take a little bit of credit. I generally applied a lot of common sense. I did have some kind of clinical background and skill in knowing exactly what was required of me from a rehabilitation point of view, but I'm convinced that having been on a product as sophisticated and as scientifically based as Equilibrium Collagen also contributed to where I am today.